Now, today, the CDC conducts critical science monitoring and health guidance to protect our nation against dangerous health threats, including the recent COVID-19 pandemic and ongoing opioid crisis. In fiscal year 23, CDC processed more than 25,000 grants and cooperative agreements to support state, county, and local public health programs. These programs save lives and federal and state health care dollars, and CDC's work has significant health and economic benefits that work to improve the well-being of the American people and to lower overall health care spending. And these programs are making a difference in all of our districts. In my state, for instance, the CDC has provided over $325 million in grant funding for projects ranging from safe women and infant health at the New Jersey Health Department to critical worker safety programs at Rutgers University. And yet, House Republicans continue to cave to the extreme elements in their party by proposing massive CDC funding cuts and the total elimination of some programs. Earlier this month, the House Appropriations Committee passed a partisan fiscal year 25 labor HHS funding bill that includes a $1.8 billion cut in funding from last year for the CDC. And these short-sighted actions threaten the progress we're making to rebuild our nation's public health infrastructure. House Republicans support major cuts to programs that address firearm injuries, opioid overdose prevention, suicide prevention, tobacco prevention, and HIV prevention. Imagine that. Last year, more than 107,000 Americans died of a drug overdose. This is still a national crisis, and yet House Republicans are looking to cut the opioid overdose prevention and surveillance program by $560 million below last year's funding levels. To me, that defies logic when we all recognize that this opioid crisis continues, and they also threaten boots-on-the-ground programs and local health departments in the communities that we all serve. So there's no doubt that we should always be looking for ways to strengthen our federal agencies, but unfortunately, House Republicans are continuing their attempts to hamstring CDC's ability to fulfill its mission. They failed to reauthorize the Pandemic All Hazards Preparedness Act. They repeatedly misled the American people about the efficacy of vaccines, and now they're undermining the CDC with an 18% cut in funding. And if that's not bad enough, Republicans are pushing Trump's Project 2025, a blueprint for a potential second Trump administration that proposes eliminating the independence of agencies like CDC. Trump's Project 2025 is a plan to consolidate power in the White House and get check and balances to the harm of the American people. And Trump's Project 2025 would undermine public health preparedness and leave us vulnerable and unprepared for future public health emergencies. It's the way for the extreme right wing to take control of our Americans' lives and our freedoms, and it's not the path we should be taking.